Welcome to Heart Healthy Living with Dr. Jackie, a Big Blend radio podcast that features Dr. Jacqueline Ubani, a board-certified cardiologist and electrophysiologist and author of the best-selling book, Women and Heart Disease, The Real Story. Spring is here, and we all know, some of us, I'm just saying, some of us, maybe me and others, had a wonderful time during the winter of cooking with butter, maybe not walking as much because it was a little cold outside. And now we're saying, I don't know how good my weight is. I thought I fit that bathing suit. Maybe not. So spring is here. And spring is when we start to think about going outside and maybe not wearing that sweater that we thought was hiding those extra little rolls. Yes, I am talking about myself, and I can. Welcome to Big Blend Radio. Dr. Jackie Ubani is back on the show. She is here every third Wednesday. Second Wednesday, not third, second Wednesday here on Big Blend Radio, talking about heart health. And, we're here talking about heart health, but how to have a happy and healthy life with your heart. So Dr. Jackie, you're here every second Tuesday. I got to make that, very plain and clear. But, those little weight rolls that I have, those little love handles, maybe not a good thing.
No, not a good thing. Not a good thing. Obesity, as we're talking about today, is just puts you at risk for so many conditions, including heart disease, which we're always talking about. Heart disease, stroke, can even give you abnormal heart rhythms. So overall, obesity is a bad thing.
Okay, so obesity is the negative word of the day. You always have a word of the month, which we'll get to. But the obesity word, and we talked about this last month, saying that you're going to talk about obesity. And I was like, even Dr. Jackie, obesity is like a strong, do we really have to say obesity? Can't we just say a little plump or a little overweight? But obesity, where do we go from a little overweight, a little naughty to now you're in danger? Is there like a big zone between A and B? Do we have a C? Where are we? Like do we have a little gray area that we're safe in? Do we have a safe zone without it being like, because I know some people that are actually pretty lithe, very, thin, healthy, and they turn out to have some heart issues, but it's different. And it's not on the overweight side. It's like a genetic butterfly thing in their heart and stuff like that. And I went, you have a heart thing and you're skinny, compared to me,
Yeah.
You're skinny, man.
Yeah.
And I mean that in a polite way, not a nasty way. Anyone skinny to me, I'm like, y'all, you're an inspiration. But then I found out, so weight it's interesting. So can we clear up that part before we get into the obese side? That, thin people can have heart issues too, right?
Yeah, thin people can have heart issues as well, because you can have a whole lot of other risk factors for heart disease that contribute to heart disease, and not just obesity. Obesity is one of the risk factors, but there are other things like smoking, high cholesterol, diabetes, hypertension, physical inactivity, family history. So there are a lot of risk factors. So just because you don't have one, as in you're not obese, does not mean you're not going to have heart disease.
Oh, okay. So that leads me to something. When I remember back in the day when I was naughty and, picked up a few cigarettes or more, that I remember quitting, and one person saying to me, well, I'm never going to quit smoking because that's how I stay skinny. Otherwise I just eat. So I'm going to stay skinny by smoking.
Well, that's not a good idea, because there are lots of risks associated with smoking that far outweighs its benefits. Like we said, cigarettes can put you at high risk for heart disease. We say it can increase your risk by up to 35%. Not only does it increase your risk for heart disease, it can also cause things like cancer, because the chemicals
Mm,
contained within the cigarette can is very dangerous and actually can cause cancer. So
mm.
offsetting your weight by taking something that increases your risk for a heart attack or for cancer just does not make sense.
Okay, but if I vape, I'm okay.
No, because vaping it, I mean, it
Dr.
doesn't,
Jackie is going to just lambaste me at the end of this podcast.
well, vaping does have the nicotine. Yes, vaping is maybe a little safer because it doesn't have any of the chemicals that you have in cigarettes. But nicotine is also not good for you. Nicotine is very addictive and it can contribute to heart disease. So, yes,
Okay.
we
Okay.
shouldn't do that either.
Okay. So wait, where is the line of healthy to not so healthy to uh-oh?
So, there's actually a medical definition for obesity. Obesity is defined by what we call a body mass index. It's this complex calculations taking your weight, your height, to calculate what your BMI is. I'm not sure if you've ever heard of that, the body mass
Mm-hmm.
index. And we define obesity as a body mass index of 30 and over. And you're overweight if you're between 25 and 30, and anything less than that is considered normal weight. So we do have a definition for obesity.
Okay. So body mass index. So we can't say that, oh, I'm just big boned and
No,
get
not
away with it.
no, no,
Well, I
not
thought that
according
worked.
not according to the medical literature. So everything is based on this number. But
Okay.
we
Whew.
also know that fat everywhere in your body is not necessarily all the same. The fat that actually puts you at the highest risk for heart disease is the fat that you accumulate around your midsection. So abdominal fat, or what we call visceral fat, has the highest risk for coronary artery disease. So
But
that's what
that's
you
where
have
it
to
wants
watch
to
out for.
go.
Right.
But it is. It's there. It's saying, hello. Yes, I'm proud of it.
Yes. Yes.
Well,
It's
okay. So there are so many factors to it, and overweightness. Some people actually are genetically disposed to this, right? And some people have it from medication. So some people have different ways of how they got there, right? So can we touch on that a little bit of being overweight is sometimes you're not physically able to. So we unpack a little bit of this on the show today about what can we do? Um, sometimes is it the first thing we look at is food? Wouldn't that be the easiest thing? Is diet?
yes. Yes. Or I don't like to say diet. I say, picking healthier choices, like staying away from the fried foods, eating more protein or plant-based proteins compared to animal-based proteins. Um, and like we've mentioned a couple of times the Mediterranean diet, which is a diet that includes fruits and vegetables and whole grains. And so that is a healthy kind of diet. So sticking with healthier options
Hmm.
is the first step. And of course, increasing your physical activity.
What happens when we turn over 50? What's going on, Dr. Jackie? It's happening. I mean, is it like, I don't know if is it just like is it worse for women and men or both of us like going in like it's just the middle age thing happens and we all go, oh, it's not going to happen. We'll just keep on, and then all of a sudden the way we lived. I mean, I swear, as soon as you hit 50, it goes, nah, uh-uh, we're giving you
Yeah.
now. What's going
Yeah.
on?
Yeah. Unfortunately, hormonal changes that we all go through as women definitely contribute to, inability to lose weight. And yeah, that can pose a problem sometimes. But there are options for, weight management if the traditional ways of healthier eating and increasing your physical activity are not working, especially if you have other risk factors for heart disease that puts you at higher risk for developing heart disease.
Okay, so if you are already dealing with a medical issue, you have to be aware of your weight, right? That's
Yeah.
also because doesn't no matter what, your heart is the end result. That's your Whatever happens with your body affects your heart. Am I right in that? Like that's
Yeah.
your thing. Okay.
Yes. 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 So you have
So,
to be cognizant. Yes.
so what is this whole cortisol weight thing? Is that also something we should be scared of? Or is that a different weight than I ate too many cookies? I think there's an alcohol weight too. Like there's different weights. All I know is like I don't want it.
Weight, I mean, I think weight is weight. If you're overweight or you're, obese, and you meet the guidelines based on BMI, you're gonna have risk. Doesn't matter how you gain the weight. Cortisol is a hormone that just causes you to just retain, you know, fat, and it makes you gain weight, it makes you hungry, it just, all of that stuff. So that
Not a
hormone,
fan. Not a
yes.
fan.
So it doesn't matter how the weight comes on. When the weight comes on, you are at high
Mhm.
risk. Yeah.
Okay. So now so many of us will be listening and going, well, okay, how bad is weight for the heart? Like truly, can we just, eat a few more carrots, drink a little bit more water, maybe walk around the block? What do we do when we're in this position where we know we're huffing and puffing it? We all know that we know when we huff and puff. We do. We can't lie about that to ourselves, right?
Right. Right. So you're saying, what do you do when the
Yeah.
traditional
What is the first step
methods
you should take? Yeah,
is,
because sometimes people are doing all kinds of surgeries and maybe that's what they need to do according to what's going on. I don't know. Not a
mm,
doctor. Um,
yeah,
I
so
know
the
people are taking all kinds of things, but
option,
like
yeah,
everyone's different, right? So I know when we talk on this show where we don't mean to generalize, but like that's pretty much what we
what we
have to
do.
kind of work on, right, Dr. Jackie? We're
Right.
generalizing here, but some people have extreme weight issues, which will be different than someone who's overweight and a little unhealthy. And, you know what I mean? So every person is different and we recognize that. So I'm just being
Yes.
careful on this.
Yes, everybody is definitely different, and you definitely need to speak to your physician who knows your medical history, who knows what medications you're on, to come up with a plan that is right for you to help you lose weight. I know you're
Mm,
probably talking about these new medications that have come out, the Ozempic
hmm.
type medications,
Yep.
GLP-1 drugs. Yes, they're actually very effective in weight loss. And decreasing your cardiovascular risk. But, they also can cause you to lose muscle mass, which, is not great. But if you do reach a point where traditional ways of weight loss are not working, then definitely you can sit down with your primary care doctor and discuss whether or not one of these drugs is right for you. So your option
Yeah.
would be either to take the medicine, or if you're a better surgical candidate. So those kinds of decisions will be between you and your primary care doctor.
Mm. Right. And I think that's important for us in general to all understand too, because what we think is good for us is maybe different than what is good for another human being.
Yes. Yeah. Yeah.
You
So
don't
it's
know. You're a coworker who you may think, oh, you're just lazy and overweight, right? I'm just going to say there's a lot of fat shaming in our world, in this country. And maybe you don't know what they're going through. You don't know what their
right.
position is. You don't know what medications they're going through, physicality
Exactly.
issues. Everyone
Exactly.
has a different thing. And I think from every doctor I know, it's always about what is going to get you to that place where you're not in danger.
Exactly. Exactly. Yeah. Because, being obese has its fair share of, medical ailments, and, whatever it takes to get you healthier, living a better life, a
Mm.
happier, healthier life, is a good idea, I think.
And also when weight gain and smoking are attached together, that like a double trouble?
What do you mean if you smoke? Well,
If you
smoke,
smoke cigarettes and
uh-huh.
then you're like, hey, I'm drinking what I want, eating as much meat as I want, and yeah, I've got a little bit of a beer belly with a little bit of, red meat weight in there, barbecue weight. Is that not like a double trouble when you're smoking on top of it? Like your
Yes.
body. Like doesn't seem to catch a break to
Yeah,
breathe.
smoking overall is just bad for you. Smoking has lots of risks. Like I mentioned earlier, not only does it increase your risk for heart disease, it also increases your risk for cancer. So doing both smoking and being
Oh,
overweight will just increase your risk all around. I know you'd mentioned sometimes smoking and, maintaining a low weight because smoking does suppress your appetite, but you don't want to substitute one bad thing in order to gain the benefit of not gaining weight because it basically cancels each other out because one is really bad for you, and doing that to lose the weight just does not make sense.
and by the way, smoking weed will not help you suppress your appetite. Just in case you all haven't heard, just, you might get those little munchies, and that's
Yes,
dangerous, right?
and yes, that's a whole other topic for.
That's a whole other conversation. It may give you some stress relief, but like you may
But
eat up the stress relief that you
that's
did
right.
good. So I'm just saying. So, speaking of that stress, so do you see anything in the world of heart disease for women on stress being a factor of weight gain that affects your heart?
Yes, stress definitely can lead to. Stress is one of the adjacent risk factors for heart disease because when you're stressed out, you tend to, at least I do anyway, I tend to, eat horribly. You just not as aware of the bad decisions you make when you're stressed out. So
Mm,
being stressed out can contribute to heart disease in patients, especially in patients who have risk factors for heart disease. So stress makes
yeah.
us not sleep, which then worsens our appetite. It decreases our ability to, actively eat healthy, exercise, and all the stuff that's good for you. So stress is definitely not a good thing.
It's so weird because when stress occurs, like actually taking a walk around the neighborhood will really de-stress yourself. I had a friend recently went through something really major and she went out into nature and she came back and she goes, Lisa, I don't know how to call this. I was like, it's biophilia. It's this stuff where nature, she's like, I became one with nature. And
That's
this is,
wonderful.
it's the actual work that she's in, but like she was in it in, she helps others in time of need, but now she was in time of need and nature saved her butt, like literally in so many ways. And she was like, I woke up with the sun. I heard the birds and
Wow.
I woke up with the birds. I'm like, yeah, isn't that the best thing on earth? And it calmed her down with, I mean, life threatening stuff, real, genuine, life threatening things. And she was like, I had no idea that just seeing the sunrise and listening to the birds call and waking up with it would save my life. And
Yeah.
I think that is massive because I think we over praise ourselves as human beings when things are
Hmm.
going wrong. Yes, our country is wacky and crazy right now, and the
Hmm.
world is scary. It's scary. Let's just be
Yeah.
realistic. Everyone's, arguing with each other still. There's a lot of drama, but we can still take control of ourselves. We have
Absolutely.
that power, and as long as we have that power, we should take it. We have that ability. And look, eggs are expensive and you don't want that many eggs for heart health. I get to, as this whole egg thing's going, Nancy and I keep laughing and going, well, Dr. Jackie says he shouldn't have that many eggs anyway. If you have heart disease, you don't want that many eggs, you
Yes,
know.
especially the yolk. That's where all the cholesterol is.
I know. So, but there's things you can do and you can change your attitude. I,
Yeah.
you know, so even, and this is something I wanted to talk about when we talk about obesity. I hate the word obesity. I detest it. And I don't even like that we're talking about it that way on that show because obesity is just so this negative thing, but everyone comes to a place and where they're at and maybe don't like where you're at. Don't, can we like change it around to like, you can move forward and maybe not don't be so hard on yourself. If
Yes.
so, and don't be cruel to others.
Don't be, yeah.
Everybody gets to a place for a reason and
Yeah.
turns around when it's time. And time is now. But anyway,
I
just
like
saying.
that. The time is now. Yes. Don't blame
Yeah.
yourself for it. You
If
know,
you're listening
sometimes,
to this right now, maybe this is your time, you know.
yeah. Yeah. It is difficult to lose weight. It's not easy at all, especially as we get older and as women and we go through hormonal changes. But weight loss is not an easy thing to do. If it was, everybody would be underweight. You know, so don't blame yourself. If it's not working, you really should, you should talk to your doctor about other options for you. And you shouldn't feel guilty about it. It is not your fault.
No, everyone, I mean, our food has changed over the years too. It has.
Right.
And so everything is a little bit different. And our bodies change and environmental changes, genetic changes. So there's always something there and um, move forward and do the best you can. And
Do the
don't,
best you can.
you got to
Yes.
look at it even when, if it's an addiction situation. It's the same thing. You could get off the cookies for a while, which I've done, and then all of a sudden I had a cookie, and then I went, I enjoyed the cookie, but don't do it
Yeah.
again. You know,
Don't do
it's
it. Yeah.
okay. I've done that
Yeah.
crazy thing where we stress ourselves out more about the diet versus the lifestyle.
Right.
And
Right.
that sucks.
Yeah, it does.
Horrible.
It
It's a
does.
horrible life.
Yeah. So,
It's,
right. A life of deprivation of things that you like, it's not, it's a horrible life. You know, trying to maybe not not give up cookies 100% because what's life without a cookie? But cutting back, maybe just having a half a cookie, one cookie every couple of weeks or something like
one,
that. So yeah,
I'm not doing the half. It's not happening. There is no such thing
just
as a half, unless I have a one and a half and I'm sharing that second half with someone else. I'm just being honest. It's just not going to happen.
yeah, you're probably right. Yeah,
But I
and
won't do it the next day.
right. Exactly. Just give yourself some, just cut back what you normally start by trying to cut back a little at a time or
And
make
celebrate
progressive
the little
efforts.
steps.
Yes,
Celebrate those little
yes,
steps.
yes, absolutely. I would,
Every little step counts. Um, Other thing on this, Dr. Jackie, what you're talking about, there's also extremes that people go through. You're talking about talk to your doctor about weight loss, right? Because
yes,
sometimes people also think they're overweight and may not be and do things that may be harmful and actually expedite a heart incident from what they're taking. Am I right on that?
yes,
With some of those drinks and all of that.
yeah. Some of those over the counter things may not necessarily be healthy for you. So definitely you should talk to your doctor, especially if
Mm.
you want to take some kind of medications to help with your weight situation. Definitely need to speak with your doctor who knows you well, knows all your medical history and knows what medications you're on, who can come up with a plan for you that works.
And always, so when you go into a medication situation, because sometimes we end up at specialists, right? And then that can affect what's going on with our heart. But we deal with a specialist over here and then one over here, and it's something you would never think would deal with your heart because it's a different part of our body. Should
Yes.
we go back to our main doctor and say, hey, you may not have seen this yet? Because I mean, I know we're trying to get our medical system to be like the no, I was going to say like the DMV, you know? I mean, we'd like that. I mean, they can catch us for things, but can we do that in our medical care system? Like something happens over here, but when we go over there, they'll get it all. But you have to let people know that this
Yeah.
happened. So we're not like, and how would a doctor, oh, something happened. They have to have that notification system. We're not quite there yet in the world,
Yeah.
right?
Right.
We're
So
getting there,
some
but
hospitals have an integrated, uh, what we call medical record, where all the physicians in the area have access to your medical record. But that's not everywhere. So if you're in a place
mm,
where, you don't have this integrated medical record where all your doctors can see what everybody's doing, and can see your health record. And it's very important when you go from doctor to doctor, especially seeing different specialists, that you tell them every single medication that you're on, even the eye drops. There's nothing that's just unimportant. Everything
True.
is important. Talk about the eye drops.
Oh, I have
Talk
friends that
about
have
the
been knocked out from eye drops, knocked
yeah,
out for days. Don't
yes.
even, though they
But
can be wonky.
right. So there's nothing that's insignificant. So you should
Mm.
make sure I mean, if you think you're going to forget your meds, just write a list and carry it with you in your wallet so that every time you see a doctor, you bring out your list and say, these are all my meds that I'm taking, including the dose and things like that.
Oh, what a good, tip because we're getting this spring and spring break, right? And travel and everything. Um, so travelers should have that as like a laminated thing.
Yes, yes, that's definitely a good idea. You should definitely carry that, especially if you have a lot of medical problems and on a lot of medications. You can have one that has a list of your medical problems and one that has a list of your medications. So if anything ever went wrong with you and they had to call EMS, all you have to do is just show
Hand it.
them, and you don't even have to say anything because it's all written down there.
Yeah, because you could be in a place where you can't talk.
Yeah,
It
you could,
happens, you
yeah,
know.
absolutely.
Oh, amazing information, Dr. Jackie, as always. But health-wise, so when we look at obesity and being overweight, and we know
Hmm.
we're there, what would be the signs other than looking at your body mass index, like you're saying, the BMI, the body mass index, when I mean, to me, it's when you're huffing and puffing more, but we travel all the time, so
Hmm.
we're always in a different elevation, which sometimes affects it, and weather. Like if we're in the mountains and it's snowing and it's super cold, I'm going to breathe heavier. It just is, you know. I'm never good at that kind of weather, and I just I suck at it. I don't want to do it, but it happens. Like if I'm in Florida in the winter and it's warm and sunny,
Hmm.
I'm not going to sound like that.
Okay.
So how do we know when are we truly in trouble other than knowing, okay, we don't fit the jeans as much as we used to, you know, when is the time for us to physically be able to tell this is the danger zone other than the BMI, body mass index, like someone at home going on their scale or just going, is this way too much over? Like this is
Yeah.
we're beyond the muffin top, right?
Yeah, yeah. Actually, that's a good question because not everybody um, is aware of what their body mass index is. But yeah, so like I mentioned earlier, that fat or yeah, adipose tissue or fat is causes the most problems when it's around your abdomen. So visceral fat or any kind of fat around your waist is what puts you at the highest risk for heart disease and all medical problems associated with obesity. So we say if your abdominal circumference is less than 35 centimeters, you're probably in a safer zone. But if it is greater than 35 centimeters, then so obesity will be contributing to your risk for heart disease, and you should try to bring your weight down.
Mm,
So just
it's
getting a
important.
tape, yeah, just getting a tape and measuring your waist circumference just right above your belly button
Uh-oh.
and and seeing what that number is. The magic number is 35. You want to be below 35, but if you're above
No
35,
matter who you are, no matter how big
yes,
my bones are, no matter how
no matter
tall I
how
am,
big your bones are.
no
Yes.
matter how tall I am.
Yeah, exactly. So that's a universal
No,
way of
you took
doing that.
away my things. Seriously.
Yeah.
Like real, for real. Like that's it. No
That's
matter who
it.
you are.
That's it. Right. Because it's really about the abdominal fat, not really the fat in your arms, the fat in your legs.
Doesn't matter that I have thunder thighs.
It doesn't matter that you have thunder thighs.
I'm allowed to talk about myself that way. You aren't. Nobody else. But you, Dr. Jackie
I was
can.
just repeating what you
No,
said.
no, Dr. Jackie can because
Oh,
she's a
okay.
doctor. She's allowed to. She's allowed to. But I'm just saying, because I don't talk about people that way. But I do talk about myself. I'm like, uh-oh, it moved and it made a sound. That was bad. That's how I know. Like, I'm like, uh-oh, uh-oh. I think weight, as soon as you start to lose weight and you start to do something, and this is something because we've been talking about doing this show since last month. And I thought about it because, we were getting out of winter and then I did dog walking. I love my dog walks. And the first time I had to do dog walks and up and down hills, big ones, like real ones, steep. I'm
Hmm.
not joking. If you haven't done anything for a few months, like you're going to
Yeah,
feel it, right?
yeah,
And I'm
absolutely.
like, holy cow. And then you realize like you're not even used to going up a flight of stairs if you haven't been
Hmm.
doing it for a while. Huh? Yeah.
Yeah,
And then suddenly you
yeah.
do it. And a friend said to me, oh, well, it's good for you. I'm like, it is. I know. Eh. But you know. But I'm going to tell you, once your body starts to realize you're doing it for a while, it literally thanks you. I don't know how to explain this. It may be in the worst pain, depending on what you did the day before. And you shouldn't get to a point where it's intense pain. Like it shouldn't be like brutal. I know Dr. Jackie always say just do bit by bit. Um,
Yes. Start
but
slow and increase your intensity.
your
But go ahead.
body likes it. It goes,
Yes.
you're thinking of me. You recognize me. I'm here. It's like a little dog. If you think your body is like a little happy dog and you're making your dog happy, you just look at your body as a dog that way. It's going to give you a waggy tail back. It's sometimes better than it's like disassociating from what you've done. Like
Right.
disassociate, pretend it's a dog, right?
Yeah.
You made this dog fat because you gave it too many, treats. And I'm not saying you made yourself fat. I didn't use that word that way. Please, good Lord, leave me alone. But I mean it like, if we had too many cookies, well, all right, we gave the dog too many cookies, right?
Right.
Um, I'm not calling people dogs either, but just look at it this way of like your body's going to be happy. A dog knows when it gets to get out and have a walk, and it is happier than treats. Well, depending on the dog, but mostly the dog really wants out. The dog wants to
Hmm.
sniff around, have fresh air, feel that movement. When your body starts to feel movement, it doesn't want to go backwards. It wants to go
Hmm.
forwards. That is
Hmm.
the one thing I know for certain. Your body wants you to keep moving. It does not want
Yes.
to it's not happy. Your
Mm-mm.
digestion doesn't work when you're just sitting.
Yeah.
Nothing works. I think, Dr. Jackie, that's the point.
Yeah.
Whatever we
You want
do
to,
for our weight, it's going to affect everything on all diseases, like
absolutely.
help to negate them, right?
Yes, absolutely. Yeah, but I agree with everything you say. You want to move more, you want to sit less because sitting is just bad for your cardiovascular health and it contributes to weight gain and everything that's bad for you. Exercise is always good for your heart, good for your heart health. You should try to move more and sit less.
Ah, I like this. I'm going to go hiking. It's dark now, but not so, but in the morning I will. I will. Dr. Jackie, always fun. But before you go, you have a word of the month. Okay.
Yes. Today
So
I oh
go ahead.
so
Go,
yeah,
go, go.
today I wanted my word is going to be pacemaker. I know people are familiar with this term now after what we heard about Gene Hackman. But a pacemaker is a device that regulates your heartbeat. It actually helps your heartbeat because some people can have slow heartbeat where the rate is so slow that it's inefficient, as in it's not pumping adequate amounts of blood to the rest of the organ system. So you can then get a pacemaker implanted, which then beats normally so that you can, get adequate amounts of blood flow and oxygen to all your organ systems. So a normal heart rate is anywhere between 60 and 100. And the people with slow heart rates that can cause symptoms, usually have heart rates low, like in the 30s. And these low heart rates are associated with things like shortness of breath and fatigue. So what the pacemaker does is it's implanted and it's then set to 60 beats a minute. And it then causes your heart to beat, every 60 beats a minute. to so that you
Wow.
can function normally and so that you can, not be so fatigued, not short of breath, and go back to the way you were.
And you get to be electric. You can do the
And you get
electric
to
slide.
you get to be electric.
It's the
Yes.
electric slide. I always looked at it as the band Jerry and the Pacemakers, but that would date me to be way older than I am. But I do know Jerry and the Pacemakers. I don't know if you want to listen to them, but they were pretty cool back in the day. You could see them on the Ed Sullivan Show somewhere, maybe even in the American Bandstand. Nancy, what do you think? Was it just Ed Sullivan Show? I probably, yeah, it was post Lawrence Welk, which is a good thing. Yeah, you weren't anybody if you didn't get on the Ed Sullivan Show. Oh, well, excuse us. La di da. Well, everyone, I know. Don't be like Jerry. But anyway, um, check out Pacemaker because it is important. I find it fascinating that we're able to use these tools now to see what was going on in patient history.
Yeah.
And is that something for you as a doctor, since you started as a doctor? Is it amazing to you to look at technology now and what you can look at in a patient and go, you said you only had 2 glasses of wine. I see 10. What? I mean, are
Well,
we
not
that close yet or not quite that close?
well. We can tell with the technology we have now. We can tell at least physical activity. If you have a device in like a defibrillator or a pacemaker, if patients come into the office and say, "Oh yeah, I've been doing all kinds of physical activity," you can pull up the activity log on the pacemaker because it can record this by how high your heart rate gets. So yeah, so the pacemaker tells us it can always tell us the truth about your physical activity level.
Well, it might have just been a new lover, Dr. Jackie. You never know. You never know. Uh-oh, we're going to get in trouble on this show. Hey, listen, whatever makes your heart happy, but don't hurt anybody else's heart in the making of it. But everyone, again, Dr. Jackie is here every second Wednesday. We love our heart healthy lifestyle conversations with Dr. Jackie. Obesity is a tough one. I was like, oh, we're going to really do this, aren't we? We're going to have to.
Yeah.
Yeah. Yeah. But the thing is,
Uh-huh.
we can turn it around. And as soon as you go, okay, I can turn around and find something happy in the turnaround. Find something goal in there. Like, hey, after 5 days, I get to have a tiny slice of cherry pie or whatever it is.
Yeah.
Find a
Yeah.
reward system. There's so many ways to get through it. And know if you're not perfect, no one's going to kill you. Don't
Right.
go there. Don't beat yourself up. Have a good time and create a journey. I think what I love about what you talk about, Dr. Jackie, is that it's a lifestyle, not a diet. Because no
Yes.
one likes to hear the word diet. It sucks.
Sucks.
It does. It does. So getting into a lifestyle that is happy and healthy, Mediterranean diet, you get to have a little glass of wine with your friends. Did you just hear that I said a little glass of wine?
A little
Did
glass, a five
did you
ounce little glass. Yeah.
I wanted to make sure you heard that.
I heard that.
I said little glass of wine, which would be 5 ounces. One for us women. Men get a little bit more, but we're not talking about that. Like, you know, that's just, that, well, we can. What do they get? We got to be nice. What do they get?
They can
We
have
get
two.
five.
They can have two 5 ounce glasses.
Oh, I don't want to talk about that then.
Yeah,
No,
we
no,
don't need to
no,
talk
no.
about
That's not fair. That's not
that.
fair. No, it's not fair. It's not fair. Two glasses of wine for men, one for women, but we're talking 5 ounces each. So everyone, you can have that. But let's stay healthy because you know what? When you feel better, you really do feel better. And that's
Yeah.
the point. As soon as your body knows you're trying to make it feel better, it feels better. And you get
Yes.
this energy burst that your body says to you, yippee yay, you care about me, you love me, I knew you loved me, and I'm here. And then you get the doggy with the waggy tail. Your body's giving you the waggy tail. So it's very cool. It's very fun. Dr. Jackie's book, again, everyone, is Women and Heart Disease, The Real Story. It's a best-selling book, and you can go get it at womenandheartdiseasebook.com, Amazon, all those great places. Thank you, Dr. Jackie. Can't wait for next Oh, next month. What are we going to talk about next? Oh boy, we did obesity. I can hardly wait. What's going to get us on next? But thank you so much, as
Thank
always, because you're
you.
keeping us healthy.
Thank you. Thank you for having me. It's my pleasure.
Thanks for joining us on Big Blend Radio's Heart Healthy Living Show with Dr. Jackie. New episodes air every second Wednesday at 12 p.m. Pacific Standard Time. You can keep up with Dr. Jackie at womenandheartdiseasebook.com. Listen to the shows at bigblendradio.com.